In general, gynecologic cancers refer to precancers or cancer conditions of the female reproductive tract. So we're talking about precancers or cancers of the cervix, uterus, ovary, peritoneum is included in that, gestational trophoblastic disease, abnormal pap smears and related issues. They all come under the title of GYN oncology. Some of the risk factors for GYN cancers, like many illnesses, we know that smoking, tobacco is a carcinogen, and people can understand that if you smoke, the smoke goes to your lungs and they can understand getting lung disorders. It's harder to convince people that smoking puts them at increased risk for precancers of the cervix, cancers of the cervix, of the external genitalia. Smoking is the #1 risk factor for bladder cancer in Americans, and so it takes a lot of education and convincing for people to understand that what they think of is a habit or a carcinogen might put their lungs at risk. It actually puts other organs at risk. We know also that one being above their ideal body weight, obesity is a constant challenge in America, and we know that obesity is a risk factor for endometrial cancer, and it's been estimated, for example, that if someone is above their ideal body weight by 50 pounds or more, that may increase their lifetime risk of endometrial cancer by as much as 10-fold. And so it's not just happenstance that many of our endometrial cancer patients are struggling with weight maintenance and so forth. Probably the best way to help prevent or catch early a precancer or cancer is to stay compliant with once-a-year exams. There's been a lot of misperception. There are certain subsets of the population that are thought to no longer need a pap smear every year. The problem with that recommendation is women are at times, and even clinicians at times, are interpreting that as not needing to go for a follow-up exam, and there's so much more that can be evaluated during an annual routine gynecologic visit and exam than just the pap smear. The pap smear, its only purpose is to try to pick up abnormal cells, precancer or cancer cells from the cervix. But the exam itself can help outline the size and the shape of the uterus, the ovaries, determine if there's any nodules, any enlarged lymph nodes. And so regular exam is so important. Any symptom that's new or different or concerning and persists should be brought to the attention of one of your caregivers. And if you're symptomatic, shouldn't wait for the annual exam, but to go in sooner. As with almost any cancer, the earlier it can be detected, the faster it can be treated, and when it's caught at an earlier stage, the prognosis tends to correlate with that, better outcome. Certainly if there are ways to prevent the cancer, that's even better. There's been a lot of breakthroughs in treatments. We now have some oral medications that have anti-cancer activity. We have the ability to send an individual's tumor tissue specifically for genetic studies, and if certain mutations are expressed in that tumor tissue, then there are targeted therapies that exist specific to that individual. And there's great amount of research being focused on looking at targeted therapies, immunotherapies, tumor-initiated vaccinations to help one's overall immune system. And so we really are in an exciting time with respect to scientific advancements and treatments of cancer. One specific example would be an oral medication called a PARP inhibitor, P-A-R-P. It's an abbreviation for the enzyme that it inhibits. But that has shown a great benefit in our women who have been treated for ovarian cancer. It can be used after completion of treatment to help maintain and prolong remission. And it can also be used in the setting after treatment has been used and shown some benefit with recurrent disease, then to get away from the IV chemotherapy and all of the potential side effects related to that. We now have some options, one of which is the PARP inhibitors that still come with side effects. It's still strong medication. Blood counts have to be followed closely, but a number of our women have done remarkably well and for long periods of time. And this is just one example of a relatively recent breakthrough, and by recent I mean within the last few years it's come into utilization in ovarian cancer. So prevention, early detection, and then early treatment have all led to better outcomes, better survivals. We've had the breakthrough of the human papillomavirus vaccine that has now allowed a significant capability to prevent precancers and cancers of the cervix. We have medications that now have been able to prolong survival. Even in setting of recurrent ovarian cancer, we're seeing patients live longer, sometimes on and off treatment over the years, but able to have not only just a longer life, but a good quality of life for much of that time, which is so important to the individuals and their family. And with the research and the steps, the progress being made, we're going to continue to see individuals do better. Problems can be prevented, they can be caught earlier. And once diagnosed, if diagnosed, I think we're going to see more and more improvement, people doing well for much longer periods of time.